This is Jonathan Iman, your professor in psychopharmacology for LPCCs. I wanted to talk with you a little bit today about how do we help our clients know if they're actually doing better. Many times people have the mistaken notion that mental health issues are similar to an acute episode of an infection. You have it or you don't. You have it for a while, get treatment, it goes away. But most mental health issues are prolonged in their duration. Many of them are lifelong problems. Some are recurrent in their manifestation. And many of them, of course, are treated in part, if not in full, by the use of medications. So, how do we help clients understand whether the treatment that they're being given is actually effective, since oftentimes all symptoms do not completely disappear? First of all, we want to make sure clients understand what would be appropriate to expect. And that really begins with the process of doing an assessment, including a family and personal history, beginning to gather together then uh, a description of the symptoms that the client is experiencing, including their frequency, their intensity, their duration, when did they begin, so on. You're learning all about that in your psychopathology class in your assessment course. We collect that information, we come up based on that with a diagnosis, and out of that diagnosis, or as we explore that diagnosis with the client, we want to begin to see what is the actual uh, consequence of the condition to the client in their daily life. And that's typically we'll use the term impairments. What are the things that are impacted in the client's life in a negative way because of the condition that we're discussing with them? Sometimes a specific symptom of the illness causes particular impacts. But bottom line is we want to work with the client, uh, helping them to participate in a comprehensive treatment program, which may include medication, may include physical therapy, may include recreational therapy, it may include sleep hygiene and nutritional impacts, changes and adjustments, as well as psychotherapy and a number of other things. So we want to put together a package, and we, of course, are contributing the psychotherapy and some guidance and common sense um, to help them to see a reduction in symptoms, maybe a subsidence of the condition altogether, maybe a resolution of what's going on. Some conditions like depression, anxiety may completely resolve themselves and never reappear. Um, but bottom line is, because many times clients will expect that something disappears completely when that's an unrealistic expectation, they may feel like, since we're primarily talking about medication, they may feel like the prescribed medication is ineffective simply because there still is some level of a symptom present in their lives, even though the symptom is actually much milder in its manifestation than it was prior to beginning the medication. So we want to be able to guide the clients in noticing changes for good or for bad in symptoms, and being able to give accurate feedback to the prescribing physician as to what changes may be happening in their lives as they're com- participating in the prescribed treatment. I'm going to see if I can pause this for a moment, which apparently I can't, so I'm going to keep talking. Okay, so I've sent out and posted a few things that may be of help in some cases. For example, a pain scale. It's a somewhat objective way to help clients determine a little more objectively what is the level of physical pain they're experiencing. That's not something that we treat frequently, but many times our clients, in fact, they may have chronic pain problems that are poorly managed by medication, and that can be very upsetting, induce a real feeling of hopelessness and depression in a client. So if we can help them to notice some level of improvement, whether it's in response to a medication or in response to physical therapy or in response to psychotherapy. It helps them to redirect their attention away from uh, an uncomfortable sensation towards something that is more pleasant and thereby allows them to live life more successfully. Whatever it is, we want to help them to be able to measure with some consistency and some accuracy. You know, some symptoms like temperature. We've got thermometers. We can get very precise measures on is this fever reduced or not by the taking of aspirin. But many things such as depression or symptoms that depression as a mood, there are things such as the Beck Depression scale that can enable us to help the client to get a more global rating of the intensity of their depressive condition. Depression just as a mood, as a symptom of clinical depression, which requires the presence of quite a number of symptoms simultaneously, that's a little bit trickier. The average person doesn't think in terms of how depressed am I, and so we want to teach them things such as a Likert scale, Likert, where people agree strongly, somewhat, they're neutral, they somewhat disagree with, or they strongly disagree with statements such as, I feel very sad most of the day. Um, you invite the client to respond to that. You can have a 7 point scale where it is, uh, I strongly agree, I somewhat agree, I mildly agree, I have neutral, and then the three stages of a disagreement. We want to give some sort of a measuring tool to the client so that we can train them um, to say, compare, what are you feeling now? You're sad right now, you tell me. Can you think of a time when you felt more sad than what you feel right now? Or have there been times where you've been a little bit sad and you can definitely say it's less intense than what you're experiencing. We help them to get some sort of a rating there. And we can ask the client in each session, well, what would you say today is your rating on, or what, how would you answer if I were to ask you, um, are you feeling very depressed today? Uh, do you agree, disagree, and how strongly? We can train our clients to make their own 0 to 10 scale rating. Um, and again, oftentimes it helps to get them to think of a time when they were um, the most anxious that they've ever been. And they might want to give that a rating of an 8 or 9 or a 10. Maybe a time when they were fairly anxious, but it wasn't overwhelming. They might want to choose to give that a rating of 4, 5, 6. How about a situation where they're feeling a little bit concerned, a little nervous, but it was pretty easy to manage? So that could be a point of reference for them if they're going to label themselves as having a 2 or 3 rating at this point in time. They might want to remember a time when they were just really relaxed, very comfortable, didn't have a care in the world. That could be a 0 or a 1. So we teach them to develop their own rating scale, give them experiential points of reference, and then we use that as a way when we meet with our client to ask them, well, what would you rate your anxiety level right now? We could ask them, well, during the past week, um, overall, what would you say your average rating was in terms of how anxious you were feeling? So there's a lot of things like that that we can train clients to rate, and it helps a lot to get them to focus in on a specific symptom rather than a more global measure of how is your depression, uh, because clinical depression is a compendium of a number of different symptoms. It's a little bit more difficult sometimes to clearly notice progress or setbacks when you're looking at the broad scale, or at least for a client to do that. So trying to help them to find ways to measure their response to any kind of treatment, whether it's medication or psychotherapy. Maybe you're teaching a client who is depressed and has um, difficulty going to sleep, so they've got insomnia as a symptom of their depression, and you're trying to train them some sleep hygiene skills, and you want to get a good measurement of that. So you could you could ask them to record when did they go to bed, how long did it seem to them to take for them to fall asleep, how many times did they awaken. There's also things that we can do nowadays that are actually kind of helpful. For example, right here, I have, it's called a Fitbit. And if I wear it at night, it literally graphs for me when did I fall asleep? Was it deep sleep or shallow sleep? How many times did I wake up? How long was I awake when I awoke? How much overall quality sleep did I get during a night? And it will track that. It links with my computer. It will read out. And so literally I could, if I were working on improving my quality of sleep, and you were training me to do certain things to assist with falling asleep more quickly, there's some very precise, detailed, objective information that I could collect and we could talk about, and you would be able to tell what is helping me and what seems to be less effective. Same if I were given a sleeping medication, is it really working or not? So we want to be alert and begin to collect a number of ways to help clients measure um, what's going on in their lives so that they can give themselves and give us a more objective measurement and more objective answer to that question. How, how do we know if you are getting better? And so we want to look at those things. Remember that most of these symptoms, as I said, they're not binary, they're not on or off, but they're a continuum. So finding the place that you are, our client is on that continuum today or over a recent span of time is really important. Also remember that many of our symptoms are not unipolar, but they're bipolar. So there's a difference between um, we might not want to focus on just, well, how sad are you, but let's look at the range of your mood from sadness to joy. Okay. And so we want to be devise a scale with the client that will allow them to experience positive emotions rather than just negative ones. And so there's a lot of opportunity to be creative with your client as you begin to devise some of these things. So Likert scales, self-scaling, there are a lot of formal inventories available on the market, the Beck Depression Scale, the Beck Inventory Scale. I posted the measurement of recovery scale, which is a fairly coarse measure, but it gives some sense of where is a client in the continuum process of moving forward in recovery. Um, I would like you to pay some attention to the brief psychiatric rating scale, which is a very comprehensive and detailed way of evaluating your client on a lot of different symptoms. It asks very specific questions in relationship to those symptoms, and some of those questions could be very helpful for you in your practice. You might not need to go over the entire BPRS with the client. There may be certain subsets of questions that you want to use to help your clients be able to tell how they're doing, as I said, with more objectivity. So sometimes just training your client and inviting them to participate in regular journaling, recording certain things through the day, through the week, and even their reactions to those observations. So let's think a bit about that. How can we tell when a client is getting better? And we're going to have another video coming up probably next week where we're going to try to go to the next step, which is based on all this information, the diagnosis, the symptoms, the response to treatment. How are we going to create an overall comprehensive care plan for our clients? So thank you for your time. I'll look forward to seeing your next postings on the forum.